so excited today to have Sharon and Emily from the University of Pittsburgh representing Dr. Patricia Document. Can you share a little bit about what you do in public health?
Yeah, I'm a recent graduate from the University of Pittsburgh. Patricia was my advisor, and now I work in community violence lab at the University of Pittsburgh Medical Center.
And I am a faculty in the School of Education at the University of Pittsburgh, and Patricia and I do a lot of research studies and collaborations together to promote health equity in the Latino community in Pittsburgh.
Thank you so much for sharing. So why public health? There are so many careers out there. So why did you choose public health?
I think I chose public health because I wanted to help people first and foremost. And secondly, I became aware of the injustices and inequities that exist in health among Brown and Black populations, and that was something that I became very passionate about, and I knew that I wanted to use my power and privilege to support the community in any way that I could.
I chose public health for a lot of similar reasons. I have a background in health administration and medical anthropology, and so public health seemed just kind of like the perfect platform to kind of mix those two together.
So from your experience so far in school or working experience, so what had captured most of your attention? What do you think has really make an impact on your thinking about what you want to do in public health or what you do in general?
I actually credit a lot of that to Patricia because she kind of took me under her wing as a Latino woman, and she just kind of pushed me and gave me all the opportunities and said, "You're going to do this." Didn't give me an option. She said, "You're going to do this, and it's going to be for the betterment of your experiences in school and your experiences in your career." So I credit a lot of that to her in my master's and academic career.
So I think my interests in public health and health equity are pretty broad, and something that kind of drives the work that I do is elevating community voices and kind of letting them take the lead and direct in terms of like research questions and research projects and co-creating together. So that's really something that I'm passionate about and that drives my work.
Wonderful. So you are the new generation of public health workers and public health professionals. What did you see in the future that is different from my generation?
I think in this generation, we've seen public health and public health information become a lot more accessible with, social media and the youth really driving a public health and an equity-based movement. So I think that's something that is going to contribute a lot to the future, and also making workplaces and schools a lot more diverse in lots of different other categories as well.
Yeah, I was going to say something similar, with the changing demographics and, with the minority that exists in the United States and will continue to grow. I just think there's such an opportunity to learn and grow from each other and to not, kind of remain in the same paradigms and the white supremacist and the racist paradigms that we've operated in for so long. I think as the country continues to diversify racially and ethnically and many other categories, I think we are only going to, I think it's only going to benefit us in the long run.
So some people are talking about the Hispanic paradox, meaning we are Latinos, we are not the same. So how do you feel about that? Or will that make a difference on the work you do? We're Latinos, but we're not the same.
I think I've learned a little bit more about that as I've gotten older, the difference between Hispanic and Latino, and with evolving terms such as Latina, Latinx. And I think it will cultivate a lot of conversations, which I think will be really beneficial to generations before us and the generations to come. And I think it could possibly serve as a unifier because we're going to have these conversations and realize that while our origin and our backgrounds may be different, I believe our beliefs are probably more similar than we think.
Okay, so for myself, I'm not Latina. I'm a Latino ally and co-conspirator. And I think, that phrase that we've heard over and over during this meeting, we are not a monolith. So I think there's something to be said for that, right? Where we are from, where we do our work at Pittsburgh, it's an emerging Latino community, which means it's very small, but it's growing exponentially. So unity, like the desire for unidad, is something that we hear over and over again from the community members who participate in our research studies. So while everyone has distinct experience and they're bringing their own social, political, economic backgrounds, immigration backgrounds, right, to the table, and we see them as whole people, I think there's also a desire for community and unity among the Latinos, at least in Pittsburgh. And I think it can be a yes and. If that makes sense.
Yeah, I agree with that. We did a study in, when was it? Through January and May, and we had 11 adult participants, 11 adult Latino participants from about 6 different countries of origin. So that's including the Dominican, Colombia, Mexico, Venezuela, Guatemala. So they had amazing conversations about what Sharon said about unity, about similar upbringings, and really they were able to connect their experiences from living in a different country and now coming to the U.S. And they were just looking for a sense of community, and we were fortunate that we were able to bring them to a small community, and hopefully that continues to exponentially grow.
Yeah, that sense of community is very important. People, especially immigrants, so they feel welcome, so they have a new home. So what do you see, or where do you see yourself in 5 years from now, or 10 years from now?
That's a great question. So I'm from California. I am a Chicana woman, and so I see myself potentially being back in California, closer with my family, and hopefully still working in the public health sphere, and hopefully still working with Latinos, and having a driving impact in whichever community I choose to serve.
So I am a newly tenured faculty at the University of Pittsburgh, and so I'm not going anywhere. In 5 years, I hope to still be at Pitt doing, similar work, community-based, participatory research, driven by the community and for the community, training up the next generation of amazing public health practitioners and researchers, and, it's just really my honor and privilege to do that. So that's where I hope to be in 5 years.
Sharon and Emily, thank you so much for sharing with us today.